बिस्मिल्लाहिर्रहमानिर्रहीम। सो इंशाल्लाह ये डबल ए बुक है, उसके नोट्स हैं, वो अपर लिम्ब के, वो हम अभी स्टडी करेंगे। बिस्मिल्लाहिर्रहमानिर्रहीम। सो मोस्ट कॉमन बोन इंजर्ड in body is clavicle. Most common long bone fracture in body is clavicle. Most common long bone fracture in lower limb, tibia. Most common carpal bone fracture, scaphoid and radial artery can damage. Most common dislocated L say carpal bone lunate and medial nerve, they can damage, and carpal tunnel syndrome. Fracture of hook of hamate. Fracture of hook of hamate, ulnar nerve damage, cuboidal tunnel in the wrist joint. Anatomical snuff box pain, radial artery. Fracture of surgical neck of humerus, axillary nerve damage. Fracture of medial epicondyle ulnar nerve damage. Fracture of shaft of humerus, radial nerve damage. Wrist drop, radial nerve damage. Interior dislocation of shoulder joint, axillary nerve damage, and posterior circumflex artery damage. Humeral artery. Quadrangular space injury, axillary nerve damage, and posterior circumflex humeral artery damage. Small muscle of hand supplies by C8 and T1 more than ulnar plus median more than T1 more than ulnar. Small muscle of hand affected lesion in C8 T1 more than ulnar plus median more than T1 and ulnar more than ulnar. Thenar eminence wasting medial nerve damage lesion. Hypothenar eminence wasting ulnar nerve lesion. Thumb and index finger drains into infraclavicular node. Middle and ring little finger drains into supraclavicular node. Thumb and index finger drain into infraclavicular. Middle ring little finger drains into supraclavicular. Clavicle receive weight by coracoclavicular joint and transmit to axial skeletal by costoclavicular joint. Clavicle receive weight by coracoclavicular joint and transmit to axial by costoclavicular joint. Ulnar nerve lies medial to, so clavicle receive weight by coracoclavicular and transmit into axial skeleton by costoclavicular joint. Ulnar nerve lies medial to brachial artery in upper arm. Ulnar nerve lies medial to brachial artery in upper arm. Maximum 2-point discrimination on lips. Minimum 2-point discrimination on scapula. Minimum 2-point discrimination distance on lips. Maximum 2-point discrimination distance on scapula. Complete loss of intercostobrachial nerve will cause sensory loss of medial side of arm. Complete loss of intercostobrachial nerve will cause sensory loss of medial side of arm. Palmaris longus crossing superficial to flexor retinaculum. Ulnar nerve is also called musician nerve. Ulnar nerve damage at elbow. Ulnar nerve damage at elbow, loss of sensations in medial 1/3 palmar and dorsal aspect. And hypothenar wasting. Ulnar nerve damage at elbow cause loss of sensation in medial 1/3 palmar and dorsal aspect. And hypothenar wasting. Ulnar nerve damage at wrist, claw hand. In fracture of medial epicondyle, fracture of clavicle, and fracture of hook of hamate, ulnar nerve is involved. All small muscle of hand wasting without lateral sparing. All small muscle of hand wasting without lateral sparing. Lesion of C8 to T1. All small muscle of hand wasting with lateral sparing. Lesion of ulnar nerve. Median nerve, laborer nerve. Median nerve damage at elbow, hand of benefit. Hand of Benedict, pointing finger. Median nerve damage at wrist, carpal tunnel syndrome. Wrist carpal tunnel syndrome. 3.5 digit on thumb and thumb sensation lost. More than thin arm muscle wasting. In median nerve damage, opposition and abduction is not possible. In median nerve damage, opposition and abduction is not possible. Ab thumb result in thumb adducted and laterally rotated. Result in thumb adducted. Result in thumb adducted and laterally rotated. In median nerve injury, patient can't make fist. In median nerve injury, patient can't make fist. Loss of sensory sensations on lateral palmar surface of hand and unable to flex finger is due to lesion of median nerve. Loss of sensory sensations on lateral palmar surface of hand. Loss of sensory sensations on lateral palmar surface of hand and unable to flex finger is due to lesion of median nerve. Carpal tunnel syndrome, pronated TG syndrome, and supracondylar fracture due to lesion of median nerve. In this location of lunate, there is median nerve palsy. There is median nerve palsy. Can't grip the cup of tea due to damage of median nerve. Can't grip the cup of tea due to damage of median nerve. Radial nerve. The radial nerve is very commonly damaged in the region of radial spiral groove. In Saturday night palsy, mid shaft fracture. In Saturday night palsy, mid shaft fracture of humerus and fracture of lateral epicondyle, radial nerve is involved. Root of thumb is numb and can't open fist in injury of radial nerve. Unable to extend thumb. Unable to extend thumb, metacarpophalangeal joint and thumb. Unable to extend thumb, metacarpophalangeal joint. But sensation is intact due to damage of deep branch of radial nerve. Due to damage of deep branch of radial nerve. Loss of sensation laterally on dorsum of hand due to injury of radial nerve.